being stuck on the toilet in excruciating pain, not knowing if you're going to be able to leave it,
Mhm.
and worrying about the upcoming call that you've got and what this means going forward, that is traumatic.
Yeah, a lot of times people are having these kind of throwaway diagnoses of you have anxiety, you have depression because of the way that you're reacting to the UTI symptoms that you experience. Is a primary care provider qualified to make that kind of assessment? And is it something that you should then ask to escalate to get an official diagnosis or to have an assessment with a mental health professional rather than just kind of trying to fight with your primary care clinician about that topic?
Yeah, I mean, I guess you know, for kind of axis one mental health disorders like anxiety, depression, there are the it depends where you are in the world, but
Mhm.
there are the diagnostic criteria, and they're not that hard to fulfill, really. And
Mhm.
this is the difficulty, I guess, I have as a health psychologist as well, navigating between psychologists and healthcare practitioners. And it's, I guess, what your question is about. Sometimes it's kind of pathologizing natural distress
Mhm.
to a condition, and where we come from it as a profession, um, is that actually we could conceptualize this more as kind of adjustment issues, right? There's a lot of distress because you're now
Mhm.
adjusting to a change in how you're used to function, and so yes, that will overlap with the diagnostic criteria for depression and anxiety, but that is not separate from what you're going through
Mhm.
physically. Um, so I guess, I mean, um, you know, the label comes back to the fact that the label can just be unhelpful.
Mhm.
Um, I think if what I would recommend in those kind of situations is talking with your healthcare provider to ask them if they can understand that actually how you're feeling emotionally only started after
Mhm.
um getting this kind of physical complaint, and that this is causing substantial distress, and would there be support for that. I don't want it to be pathologized as if I just sort out my anxiety,
Mhm.
then this will go away, because I don't buy into that. And again, it's difficult because not all clinicians themselves have the knowledge. Health
Mhm.
psychology is a very new area still, but I was just having a conversation with a GP yesterday, and she was saying, if you feel like you're not gelling with your healthcare practitioner, go to another one. You've got that choice, and sometimes it is just the way that they're communicating doesn't work, and that's
Yeah.
absolutely fine. I think it's important that you're both on the same page.
I think that's true for a lot of people, that sometimes finding the right clinician can be the way that they move forward, whether that's physically or from a mental health perspective. It's tricky, though, to
Yeah.
find the right primary care provider. But I also hear from people that it's really difficult to find the right mental health therapist or counselor. Do you have any
Mm.
advice for how to find someone that will be able to help you?
Yeah, it is difficult because I suppose there are so many different models of therapy.
Hmm.
So there's cognitive behavioral therapy, acceptance commitment therapy, psychodynamic, and many more. Um, and they're models of therapy, so they're the processes used in the therapy room, but they're not saying what they're applied to.
Hmm.
So you could use acceptance commitment therapy for anxiety or depression, but that's not necessarily interweaving the physical experience. So it's important, that you're kind of yeah, finding a practitioner that is accredited by a regulating body, for one,
Hmm.
so that because there's a lot in this mind body space. There's a lot of faff, what's the word, nonsense, basically.
Yeah,
There's a lot of
yeah,
like
accurate.
unlicensed,
Yeah.
yeah, practitioners. So I think it is important to make sure that you're clear on what the model of therapy or approach they'll be using, and that they're accredited with an accrediting body, that is, you know, recognized. So the common ones are, well, I'm only familiar with the English ones, unfortunately, but British Association of Cognitive and Behavioural Psychotherapists, and the Health and Care Professionals Council. And I think that there is a resource probably online where you can look at the main regulating bodies for, you know, professionals practicing psychotherapy, practicing psychology. But I think then the second problem that you've got is making sure that they're also aware of how psychology can be applied, or how their model can be applied in the context of health. So this is not, you know, a simple answer. I think seeing if often, you know, these therapists will list their expertise. So they'll list, you know, they're used to working with trauma, or they're used to working with personality disorder, or whatever it might be. And if they're listing, you know, working with chronic conditions or adjustment issues, or whatever it might be, that seems in line with your experience, then I mean, those would be the ones that I'm seeking out to go and talk to, and then have a discussion with them first, and then see what you think. You don't have to sign up for anything. And the way that I've kind of counseled my friends with finding a suitable therapist is to do just that, you know, make a short list, make sure they're accredited and they seem to be ticking your boxes of what they work, you know, the remits that they work in, and then call them up, see what feeling you get from them, and then you can take it from there. Yeah,
that's really good advice. A good place to start as well. There's a topic that comes up a lot when we speak with patients or people from our community, given they're not our patients, but they often describe that the experience of chronic UTI has somehow resulted in PTSD, and they often play that down, but I think it's a really valid thing to say and to feel. Can you explain how a chronic illness like chronic UTI could result in post-traumatic stress disorder?
So PTSD, I guess the kind of diagnostic criteria for that is that you've experienced a trauma, so something that's been really distressing, that you know, feel really in fear for your safety, or, you know, it's had a huge impact on on you in terms of that emotional disturbance. It might be something that's made you really, really sad. And then, you know, the key characteristics, symptoms that need to be present for PTSD are the re-experiencing. So it comes back to you as though you're reliving it, and that might be visually, or it might be, you know, sensorily. You feel like you're back there wherever it was. It can also be, you know, nightmares. So it might not be that you're getting kind of flashbacks in the day, but you're getting nightmares back to something along the lines of what you experienced. It might not be exactly. And then the two other things are hyper-vigilance, which is, you know, feeling on edge and feeling really worried around something, which I'm sure lots of people can relate to. And it might also be irritability, which is, you know, actually a really common sign of hypervigilance, I find, with people with PTSD. And I credit that almost to the sensory overload. Your body's in this fight or flight kind of state, and then anything else is going to be completely overkill to process. And then the last thing is avoidance. So you're kind of avoiding things that remind you of it, that hop back to that time. So there's kind of those different factors. So it might be that people have PTSD in that sense, you know, fitting all of those boxes, or it might be that they've had a traumatic experience and they're not quite fulfilling that criteria, but it's, you know, it's a trauma and it's had a significant impact on their their whole kind of presentation. And I suppose, you know, it makes sense really, because I mean, being stuck on the toilet in excruciating pain, not knowing if you're going to be able to leave it, and, you know, worrying about the upcoming call that you've got and what this means going forward, that is traumatic. You're fearing for your safety, your livelihood, your just well-being. So I mean, it makes complete sense that people experiencing these symptoms do get those kind of would get something like PTSD, or at least, you know, a huge traumatic imprint, because it's intense suffering that you can have with these symptoms.
It is intense, and it can be triggered again, even with the slightest twinge. Like you described, you will get twinges sometimes. It's impossible for most people to not suddenly start reliving everything that happened and fearing that they will end up there again. Do you have mechanisms that people can use for when those feelings come up, when it is unlikely to be a full-blown situation like you have had before? How can you kind of calm yourself to get through that?
I mean, the first thing is noticing your body kind of alert to that twinge. So, I mean, the bit that really was one of the worst sensations for me was that kind of, tugging feeling, but with the burning awfulness. And so if I get a slight bit of that at the end of passing urine, and it feels like in my stomach, I can feel it, that would be the one that usually my whole body would then kind of clamp up, and I'd just be there kind of trapped in a state of despair. So I think the number one, the first thing is just noticing that experience, and noticing how quickly your mind's kind of jumped on that experience, the full body experience that's reacted to that particular symptom, and trying to, rather than go down the rabbit holes of where your mind's, because your mind's trying to protect you, or what's going to happen then, and or you need to do this and blah 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 blah, but it just goes too quick and it's really anxiety provoking. It's like if you needed to solve a puzzle and then you just had someone there going, oh, have you thought about this and have you thought about that? That's what's going on in your own brain. And it's not going to calm you down. So I suppose just noticing that happen, and then actually your first priority then is trying to calm your body down, rather than go off in problem solving mode, or which actually ends up being kind of spiraling worry. Just trying to calm your body down. And I think, just some good breathing practices really help with that. We know that it activates the parasympathetic nervous system, which kind of counteracts that autonomic fight, flight, freeze response. So I like the 4-2-6 breathing. So where you breathe in for 4, hold for 2, and then out for 6. And a couple of kind of rounds of that can just give you enough pause. And then the thing about worry, though, we know that it comes back in. So you might feel calmed and the symptoms might not be as severe as when they first came in. And say, I'm using this example of getting up off the toilet, then you try and give it a go, or you wipe then, or something like that. And then you feel that sensation and it all starts happening again. So it's kind of giving yourself license to repetitively make those pauses to calm the body down enough. And then if you have to sit back down on the toilet, and then do it again bit by bit. And usually what people find is just slowing down and tuning into the body's automatic hyper-vigilant response, and trying to calm it on that level, then eventually helps you to just interrupt that worry spiral and get out of there. And actually it doesn't escalate, but it can be a bit of a repetitive thing to begin with.
Yeah, I think it would take quite a bit of practice, especially when you're so used to the escalation happening. But that kind of brings up the topic of doing something to stay present when you have this hypervigilance. So your bladder is supposed to tell you, I mean, your brain is supposed to tell you when your bladder has an issue, when it needs to urinate. It's just the way that it works. So how do you get to the point where you can ignore those signals, given they're supposed to be there, or at least ignore them enough to engage with the people around you and to remain present?
Yeah, it is really difficult. I mean, I think having an idea of the broader picture, which is that, the little repetitive practices that you do cumulatively can help this to become automatized, in the long run. So it doesn't have to be quite so intentional. I think that just having that understanding can be really, really helpful. And in the moment, I guess there's a couple of strands. One is, knowing whether you do need to pass urine based on how much you've drank. So, if this is a real signal versus something that's, just ongoing, that's gone wrong and shouldn't really be there. And I think if you can rest, knowing that actually I've been and passed a substantial amount, and so this is a faulty signal, as it were, that's your permission to try and disengage, right? So I know that I don't need to. This is my brain throwing up something that it doesn't need to right now. So then understanding, okay, so what I'm doing now is trying to retrain my brain, which is difficult. I mean, I think about it like training a super enthusiastic, doesn't have a clue young puppy, because it'll keep coming back. And so I mean, it's not as cute as that.
Definitely not.
But it's definitely a similar process. So I mean, the only thing that you're asking of yourself is to, whenever you notice that your mind's going to the sensation predominantly, and that's hogging your view or your mental spotlight, you're moving that back to whatever it is you're engaging in. And I think as well, just understanding that doesn't mean that when you've got your spotlight on your friend who's talking to you, you're not also gonna feel that kind of twinge still. You are, but as long as your whole spotlight isn't kind of on that, you're still helping your brain I guess reprocess, and the more you do that, the more you're helping it to kind of de-amplify that signaling.